Welcome to Let's Talk About Health in Africa, a podcast on which we talk to leaders, practitioners, and change makers about some of the things we should be doing to improve healthcare in Africa. My next guest today is Dr. Allan Pamba, former CEO of Nairobi Hospital, who was also a vice president of pharmaceuticals, East Africa, and government affairs at GSK. Dr. Pamba is coming from one of Kenya's top private hospitals, which offers specialized treatment to both locals and foreigners who fly in from other states. It is considered amongst the best private healthcare centers in Kenya and in neighboring countries. And it has a long-held reputation of quality services. Nairobi Hospital is a critical part of Kenya's national health infrastructure for delivering healthcare. Allan, welcome to Let's Talk About Health in Africa.
Thank you, Lenias. Pleasure to be here.
Wonderful. I thought we could start the conversation by going back to your life as a child when you were growing up in rural Kenya and some of the odds that you have described previously of surviving your childhood, some of the big killers of children, challenges like malaria, pneumonia in rural Kenya, which is a reality that is facing millions of children across Africa. Can you tell us about that?
Thanks, Lenias. First of all, great pleasure to be in your podcast. When I present in forum like this, one of the things I try and impress upon your audience, I mean, all the audiences that listen to me, is make your career count. Make it count because it's ephemeral, it's short. And many of us have a privilege that majority of Africans, majority of brethren in the continent don't have. It is a poverty of ambition to focus on me alone. I've got to understand how what I'm doing today puts bread on my table, but also puts bread on 2-3 other tables, because it's not just about me. And the reason why, to give that a bit of context, I've been very lucky and privileged to do amazing things with my career, which are a complete contrast to where I started life. I was one of 9 children, so typical African family. I was bang in the middle, number 5. I was abandoned, I'd like to say, by my parents in the village to grow up with their parents, my paternal grandparents. And back then, I never understood why I was missing the razzmatazz of the big city Nairobi, where my brothers were with my sister. And I was left in the village with cows and everything. And the paradox of life is right now, that's all I want. You know, it's now so attractive. But growing up, just to paint a bit of a picture, no running water, no electricity. You know, everybody was in bed by 7 p.m. You know, everybody worked in farms. That was our source of livelihood, and cattle. And we were surrounded by disease all around us. In my childhood in particular, malaria, pneumonia, diarrheal disease were very common in children. It was not uncommon to hear about death of a child. And every death is tragic, but when I recollect back then, I am surprised by how quickly people recovered and moved forward, because death was just too common. And it's part of the reason why families were large. You knew you're going to lose a couple of your kids, and that was fine. So my survival was, there's quite a bit of luck, and I think a lot of love from my grandparents who took care of me. We never had Western medicine. You know, we were treated with herbs. Whenever I had a fever, or any of my cousins had a fever, my grandmother would disappear into the forest, come back with some leaves, crush them, and this bitter concoction, you know, would be given to you, and that's it. That's your treatment. Then fingers crossed to survive it. So growing up, I did witness quite a bit of death. But my story changes, and actually was changed. It's a long story, I'll cut it short here. I was almost eaten by a hyena when I was little, so the story goes. And then my parents decided, no, he can't stay here. He needs to stay with us in the city. So I end up going to the city as a young boy and joining the rest of my family. It was so weird because my brothers were all going to school, Western schools, wearing uniforms and so on. And I come, from the village with jiggers on my feet, and I was just completely cramping their style. So I remember they would be told, you need to walk with him to school. And they would go a certain distance, and just before the school, they say, well, that's where the gate is, and they'll bolt off. So my early years of early education in the city of Nairobi was characterized by solitude. But that worked out well for me because it meant to spend more time with my books. Again, to fast forward, I ended up enjoying reading and studying a lot. And with scholarships and support, ending up in medical school. I ended up in medical school because my grandmother impressed upon me when I was very young, living with her, that I don't know how foresighted that woman was, but she said, you're going to go to England, this country called England, which I don't even think she understood. And she said, when you go there, never forget where you came from, and try and make sure that you help those of your relatives you've left here who still live under all this poverty and disease that you just left. That stayed with me. And for the longest time ever, when I was very little, I believed I had to be a doctor. And so I was very lucky in the sense that I ended up getting to that goal. And I qualified for medical school. Again, fast tracking, but when I qualified, you come out, you're a young man, you feel you can change the world, and then HIV/AIDS hits Africa. So when I started practicing medicine, the biggest problem in Africa was HIV/AIDS. 90% of cases were in Africa. And for those who practice medicine then, they'll remember that our wards, if you had a ward with 100 beds, at least 90 cases were full-blown AIDS, literally just waiting to die. And one of the saddest things, my saddest memories of medical school, were professors who say, we're going to start the ward round at bed 90 because there's nothing I can do for all these people. And then see 10 patients and disappear. But as a medical student, you're left with those patients. So coming out of medical school, that's what we were dealing with. It's very humbling. One of the best things I ever did, I did very early in my career, which was setting up one of the first HIV care clinics in Kenya. This was in Kilifi, a small town on the coast of Kenya. And it was against a backdrop of massive stigma, in particular by my fellow professionals, doctors, nurses, who never understood why I needed to do that. But we did it. I got into about 100 patients, all very young people. Unfortunately, we started losing many of them. And that's what propelled me to what defined the rest of my career. I decided to see the forest for the tree. I was seeing 100, 200 patients a day, and I wasn't doing much for them. And I started developing ideation around public health and the importance of the correct public health principles and approaches in Kenya and in Africa. And that took me to London, where I went to the School of Hygiene and Tropical Medicine. I did my MPH there, and then I joined GSK, and the rest is history after that.
Very interesting life story. Thank goodness for your grandmother. You turned out to be a doctor, and she kept you alive with all the amazing herbal medicines that we are not appreciating enough. So well done, Grandma. So you were working as a young physician in your early career. You set up a clinic. You're losing so many patients as a result of the situation on the ground. Then treatments started to become available. Tell us about that. What impact did that have on the lives of your patients when the treatments were becoming available?
When I started that clinic in Kilifi, which would have been about early 2000, there was no treatment access for ARVs in Africa. Let me just paint a picture. So I say I had 100 kids. I call them kids because they were all young, 21, 19. They were very young. I was seeing them regularly and basically treating opportunistic infections and listening. That's all I had. Now, then we started reading about the early ARVs that were having a Lazarus effect on patients in Europe and the US. And I thought, my goodness, I need this. These guys, they have hardly lived their lives. But there was a complete access barrier there. A treatment cost then was $15,000 a patient a year. Now, patients I was seeing lived on $2 a day. I mean, there was no discussion about it. So I was infuriated by the pharmaceutical sector because of this. I was very angry and I couldn't understand for the life of me why medicines could be available to treat something so tragic as HIV/AIDS that really hit the heart of Africa, young, productive age groups. And yet we had no access to, there was no urgency in bringing those medications here. And when you run a clinic, you do see the urgency in this because you're dealing with individual human beings, individual stories. And back then, from diagnosis to grave was about 3 to 5 years. So the clock was ticking on these kids. And I could hear it. They couldn't hear it because many of them were also illiterate and would actually laugh when they were told they had something called HIV/AIDS. They'd come to my clinic laughing. They had no understanding, what that meant, because these were early days. So I joined the pharmaceutical industry not because I liked it, because I hated it. I keep telling, I tell my friends this. It was such a dilemma. When I went to the London school, I finished the post jobs on the wall. All jobs are gone. This is one job that's stuck on the wall. It was GSK who were looking for an African physician who had worked with HIV and wanted to work with the HIV groups. And there was only one in the class, and I never wanted to do it. But one of my classmates impressed upon me to interview because he knew the recruiting manager. So I interviewed and left. I left England, came back to Kenya. And 3 weeks later or something like that, the phone rings, they're calling me. We'd like to offer you the job. You can imagine my dilemma, I'm going to sell my soul to the devil here. But having said that, I did take up the job. I thought I would do it for a year, just out of curiosity, see what's going on in there. And I found one thing. I found a platform. They gave me a voice. And I said, I'm going to stay. I'm going to stay because there's a listening ear here. People want to know. They just don't have an appreciation of what's going on in the continent, be it with regard to malaria or HIV or tuberculosis, the big killers in Africa then. So I ended up doing a 13-year career with GSK. And most of that time, I'd like to believe I was a mouthpiece for the patients that I left behind in Africa. And I was so happy to see some of the changes that happened, not just in that one company, but in the industry as a whole, related to access. So some of the changes that I'm most proud of include, taking this differential pricing approach to medicines, which helped to bring HIV medicines and other medicines into Africa because it's no longer one price fits all, $15,000 a patient a year everywhere in the world. They price them depending on the economy where you're commercializing the product. They also include provision of voluntary free licensing to generics. If GSK develops a dolutegravir, which is an amazing HIV drug, and it doesn't have the capacity to manufacture and supply Africa, they give a free license to Cipla to manufacture it and sell it in Africa. And Cipla will do it at rock bottom costs, and they have had no R&D costs, so of course their absolute price will be lower. And you launch that product in Africa at the same time you're launching it in Europe and the US. So there's no delay. That sense of urgency kind of kicks in. I'm so proud of developments such as the first malaria vaccine. It wasn't the most ideal vaccine, but I was in GSK and I supported the teams that supported development of a malaria vaccine. And again, the teams that were at the core of that development, I had the good opportunity to tell them stories about what malaria is like in Africa, what it was like for me when I was growing up. And that's very impactful in terms of motivating the right action and the right decisions. So industry changed to try and accommodate our environment in Africa. There's a lot now than there was, say, 15, 20 years ago that we can work with to improve access. Question remains, has Africa changed to take advantage of those changes that happened to build access for our populations?
Excellent. That's really great. So you were able to use your experience to influence the thinking of your colleagues in Big Pharma in terms of the business model that are most suited to the environment that you were coming from and what the challenges there are. So then you did all of this, and it sounds like you've had some great results that you are very proud of, some major contributions to the perspective of farmer towards African patients. Then you decided to come back to Nairobi and rejoin the workforce in a health institution in Nairobi. What made you come back?
Well, actually, I first came back with GSK to help with driving the African vision. So that was 4 years before I joined Nairobi Hospital. And that in itself was exciting. I've kind of touched on some of the things that we're able to do with that. But fast tracking to Nairobi Hospital, I always wanted to end my career in Africa. I'd done 13 years in Europe and the US, and Atlanta, I felt Atlanta as much as I needed to learn. And there was this urge to be back in the continent and to contribute from the continent. It's an exciting place to be, Africa. You know, with all the ups and downs and chaos that we have, it's still probably one of the most beautiful spots in the world. The most challenging in terms of an exciting career, and there's never a dull moment. So I was dying to come back. There's no routine in Africa. In the UK, I was on a routine, and I kind of felt like, okay, it's going to be automatic. I could predict what my week was like, you know, almost to a T. And that's fine. And it's at some stage, some people like that. But I like the idea of coming back to a continent that was in evolution and in need of evolution and contributing from the soil, from the ground. So I came back, and you know, when I was offered an opportunity with GSK to go back to London, I said no. I think that's at the end of that chapter of my life. Let me try and open a new chapter based here. And Nairobi Hospital advertised for a CEO role. I applied like everybody else applied. I turned up and interviewed, and surprise, surprise, within the same day, I was offered the job. So, you know, I interviewed at 4 o'clock, at 6 o'clock, I was offered the job, which was an amazing, privilege and honor, because I grew up in awe of the Nairobi Hospital. It's one of the things that I distinctly remember as a child, my father telling me, this is not for us, son. Let's move on. We're going to go to what is for us. Because we couldn't afford it at some point in our lives. You know, there was that, and there was another really big hotel, I wouldn't name it, here in Nairobi, where I wanted to have a soda. And, we were looking for a place to have a soda. I was walking in town with my dad, my little kid. And I said, oh, they have soda here. We can go in. And he said, no, we can't. You know, this is not for us. And I grew up thinking, well, it's going to be for us one day. So you kind of, I like a good challenge. So when they offered me that job, all those memories came back. That was one dimension. But the other dimension was it's potentially a major contributor and thought leadership platform for health in Africa. And I'll explain this because, the contradiction that one might see there is that, look, this is an elite private hospital. You can actually start there and reach every patient in Kenya. And they had a strategy to do that. For those who don't know Nairobi Hospital, it's an amazing 350-bed state-of-the-art hospital with probably the highest concentration of the best medical brains in Africa in that square, foot area where it is. So if there's a place in Africa, especially, north of South Africa, where you want to be if you're critically ill, I think it's that space. There will be someone there and equipment there that will save your life. So it's kind of the best that we can do in Sub-Saharan Africa, showcased right there. But at a cost, obviously. It's an expensive facility. Now, when I got in, I was excited for two reasons. Number one, it's a turnaround project. Good as it is, it had had a long history of major governance issues. This is public knowledge. Everybody knows about it. And poor governance sooner or later crashes the house. So I went in knowing this, and I felt challenged to go in and drive change. So that was my first excitement. Then number two, I've always thought that there needs to be synergy between the best and the worst, or the less good in terms of healthcare delivery facilities in the country, so that the best is mentoring and helping where it is less good. The dichotomy here is the Nairobi Hospital, on one hand, the ideal, and in my view, majority of the government facilities in this country that are struggling to deliver good quality healthcare, but also smaller private hospitals. Now, there is no collaboration whatsoever between these two, not even on thought leadership level, which I found tragic. And I felt that that was going to be the second thing that I do, that if I am on that platform, then I'm going to try and make sure that these 750 best medical brains in Kenya that make a lot of money working in Nairobi Hospital also get a platform to serve the rest of the nation, because they wanted to, as I found out as well. I cannot count with the fingers on my hands and my toes how many top-range consultants walked into my office as CEO of the Nairobi Hospital and told me, it's not enough for me to come here and make money. What's going on in Kisumu District Hospital? What's going on in Mombasa? What's going on in Thika? They wanted to understand, can we build collaborations where we also reach out and support other facilities to grow up and come up? So I wanted to kind of create that connectivity. Now, I wasn't there long enough to do all the things that I wanted to do, but I still think we got a few things done when I was there.
That's an amazing story. You wanted to use this to catalyze improvements in healthcare across the country. And even more amazing is that you had a team that shared the same vision. And it's a shame that this vision was not able to be realized. And I imagine part of the problem was that the hospital had had a ton of governance troubles way before you got there. We have read about questions of conflicts of interests, lack of accountability, lack of transparency on how decisions were made or how funds were being used, and so forth. So a lot of issues, and you were unfazed by all of this because you saw a much bigger picture of what you could do with that situation if you were able to transform it from what it was to something even better. So as someone who has been inside this premier organization that has been riddled by all of these challenges that no doubt affects the value that it's able to deliver to its clients, do you think that the situation can be improved given enough time, if you stayed there longer, or if somebody comes with the same vision that you had? From what you've seen, is this something that can be improved?
Lenias, that's a very good point. I'm forever an optimist. My answer is going to be yes. My answer is going to be yes, but caveated that it will not be easy. See, what happens is people get compromised. People get compromised for various reasons. At the heart of the governance issues are very strong individual interests. You can be looking at a set of a painting and everybody sees it through the lens of their own eyes, with their own interests. And at the end of the day, that painting could be enhanced, could be stolen, could be added to another painting. There are a variety of things that can happen depending on who wields power in the group of people staring at that painting. That's Nairobi Hospital. Now, you can go in there as a CEO and turn it into something amazing that is bigger than taking care of private care patients, providing private care for patients in East and Central Africa. You can turn it into a beacon of something that actually pulls other hospitals along in terms of raising their quality, although they may have different pricing, standards, and delivers impact beyond just delivering a bottom line, for itself. But you can also tear the animal apart and walk away with whatever you walk away with as an individual. And this is the poverty of ambition that I talked about. In Africa, we suffer from a poverty of ambition at individual leadership level. everybody is thinking about me, myself, and I, sometimes not even their kids, which is completely catastrophic. So somebody goes into a role such as I did, or into a board role, and all they think about is, I've got a year here, or I've got 2 years or 3 years. What can I get out of this for me? And if everybody's thinking like that, then poor institution, it's not going to be around for long. It takes leadership with integrity to step back and say, look, I'm going to go against the grain here. And sometimes you find that you are very much in the minority, which again really shocked me when I went to the hospital, as you correctly put it. I built my career in GSK, which is a global multinational with very strong governance structures. And then I came to a premier local institution and found that the kind of conversations that people were having with me, be they some of the board directors or some of my staff, were complete red flags in a GSK setup. Completely. I would be shocked, but they would have those conversations without batting an eyelid. And after a while, you realize, well, this is the culture here. It's a culture of kickbacks. It's a culture of, because I'm CEO, if you go through the tendering process, then you have to come and ask me who you give the tender to. But then I ask, why would you then come to me? Why go through that process and come and ask me? That's the culture. That's what people are used to. They think if they don't do that, they lose their jobs. If they don't do that, you will not see them in good light as their boss. So it's a process which I started of looking at the team and saying, all right, can I get the bad apples out who will never change? Because they're just who they are, they'll never change. Try and get a few good apples in. And then can we start redeveloping a new culture? And at the heart of that was a lot of empowerment, where I would tell my HR director, my finance director, my procurement director that, look, you have a job and a job description that you are supposed to adhere to. You're empowered to make your decisions, and then check with me if you're in doubt. And if you get it wrong, I'll support you. And step back, from decision making and allow people to make decisions and take accountability for their decisions. They never had that, before my time, at least, the ones that I found. The CEO decided everything, which completely defeated the purpose of having people in those roles. And then if you concentrate all the decision in one office, sooner or later, you get corruption, So when I devolved power, or I started the process of devolving power in that way, you quickly realize you're pissing off someone else, because there's someone else above you who expects you to use that power to their benefit. And now if you say, no, that's the finance director's decision, they'll just tell me what they've decided and I'll support them, then somebody's pissed off, because now they have to go all the way down in the organization. So I was an inconvenience. Now to your question, can it be turned around? Yes, it can. What will it take? Leadership with integrity, patience, and willingness to pay an ultimate price, because it boils down to that. It's a big money exchanging hands. When big money exchanges hands, there are people whose ethical standards are so low, they look at human life very differently than you and I would, which is a shame. But that's part of the battle of changing healthcare in Africa.
Absolutely, absolutely. And indeed, many Kenyans, I'm sure, believe that the institution, Nairobi Hospital, has been captured, and it's not easy to turn these things around. Like we've seen similar situations play out in South Africa with the Gupta brothers scandal, and so it's very difficult. So, and you mentioned how individuals within the organization on the board were compromised, and we've heard stories about conflicts of interest where some of the legal representatives of the hospital worked for law firms owned by board members, and tenders being awarded to companies that were owned by people with strong links to the board or owned by the board. So, and what is interesting is how this becomes a culture that is very normal and accepted, and people are not even attempted to hide it. And we see this, not just in Kenya, all over Africa. This has become normal practice. People don't even feel the need to hide it. And it's hurting people, it's hurting healthcare. So for you, Allan, your in the midst of all of this, you're trying to transform this organization. At which point is it clear to you that you are in a situation that is untenable? The organization as it is clearly not ready for the changes that you're trying to implement?
I'll take a step back and say, when I looked at the board I worked with, I had some incredibly amazing leaders with great integrity, incredibly amazing. And then I had the exact opposite, all within the same board, you know. And it is just unfortunate that the good apples were the minority, you know. But I have to give them kudos, because for me to have been there, even as long as I was, it was down to those incredibly good, you know, board members with integrity who mean well and really want to see the facility go where it needs to go to. As I said, though, in the minority, we, you know, fought a good battle and did as much as we could. We got to a point where I was having conversations with a very senior person in the board, because I answer to the board, on contracts that were his personal contracts, and he wanted those to be done. And it was my signature that would be the last thing on paper. So first of all, with or without my signature, whenever you do a corrupt deal, somebody will die. People forget that, you know, people forget that. If I take money from an institution, a health institution in particular, that I'm not meant to take, something will give. Either a nurse will be underpaid, and then she has to have 50 jobs to feed her family, and she's going to come to work spaced out and make a mistake. Same can apply to a doctor. Or we're going to compromise on some medication that we normally buy, you know, brand, very high quality, and now buy generics, and then still try and charge patients brand to make our numbers match. Somebody's going to pay a price sooner or later. And sadly, in the health sector, it may be death. Now, one of the things I used to tell my board members is we must not forget that we are all very privileged. This hospital is probably where we're going to see our last sunset. President Kibaki passed on in that hospital. Our former President Moi passed on in that hospital. You know, this is all in the public domain. And what I tell them is that, do you want to end up here as a patient at a time when you're not a board member, you're not a CEO, and everything is run down by corruption, and pay the ultimate price? You know, be seen by that nurse who is stressed out, they're not well paid because of a culture you propagated when you were in a position of power? Or do you want to end up in a beautiful ward with motivated staff, quality medication, and enjoy your last moments with your family around you in a facility that you helped to build? Obviously, when in the context of corruption, there's normally myopia, people are very short-sighted. That becomes a conversation, you know, in the sky. But that's how I look at things, you know, and that's the gap that I think we see. I mean, Nairobi Hospital is one example. There are many institutions in Kenya, in Africa for sure, which are badly run, that we need, you know, to start turning around as beacons of examples and slowly begin to change the culture.
Absolutely. It's really good to get a glimpse of, you know, your view of how those challenges actually trickle down to affecting the health workforce that is within that institution. And we will come back to that in a minute, how those effects actually compromises further service delivery beyond what's happening at the board level. But Allan, can you just paint us a picture of how these kinds of governance challenges of the nature you were experiencing at Nairobi Hospital, how do they impact service delivery, quality of care? What does that look like for a patient who is experiencing that?
Yeah, completely. There's a trickle-down effect, and somebody pays the price. If you look at the structure of a hospital, we use the example of a private hospital here, but you could draw a parallel with government facilities as well. In the case of private hospitals, you generally will have a board with a board chair and board directors. So the first thing is that board correctly composed? Are the right people sitting around the table? Or is there a chronism? is their vote rigging, the wrong people are sitting around the table, which means their motivation is obviously not the right motivation. So it starts there. And they'll have their charter and they'll have their mandate to guide the CEO on the strategy of the hospital and on budget and auditing, the institution. Then you have your CEO, which is normally a very powerful position because the CEO and the executive team will build a strategy, and hopefully they build the right strategy, and ask for budget from the board to execute against that strategy. As they execute against the strategy, they have their teams under them, the different departments in the hospital with all sorts of staff employed who read off the top because the leaders set the tone. And they'll execute that strategy with integrity, depending on what they're reading off the top. And if they execute the strategy with integrity, then when the board audits the institution, there are no findings. We have a budget of 10 billion shillings. We spend it in this way. We made a profit of so much, and no loss, no leakages, the system. Now, when you have bad governance, typically it will start from the top, because if there's no bad governance at the top, through audit processes and actions, the rest of the organization tends to be clean. But once the top has a problem, then you begin to get direction given to the CEO with parochial interests and not the interests of the institution. The CEO and their team, the executive team, they want to expand the facility and say, we need to add 3 operating theaters. Somebody in the board might decide, now, my friend doesn't sell theater material, my friend sells pharmaceuticals. So they will push the decision to, no, you need to expand the pharmacy. But that's based on a parochial interest, because they're going to be pushing afterwards for their friend to do that expansion. Likewise, the CEO may decide, no, we don't need to put any infrastructure. We just need to raise salaries and motivate staff. Somebody in the board will think, what's in that for me? We need to do construction because I have a construction company. Let's put up a building for 5 billion. Then my company will be able to do that. So when you look at the integrity of the board, you have to look at the composition of the board and say, has everybody earned their seat at the table? What's motivating them? Is it just money, personal gain, or do they have the interest of the institution at heart? And then do they have a board charter that clarifies what their role is so there's no overreach? Now, in the absence of all of that, what you find is chaos, which is you will find board members intermingling with senior management and below on a day-to-day basis. What is a board member doing in the hospital talking to the procurement manager? What is a board member doing on a day-to-day basis in the hospital talking to the finance director? There are red flags all over that. And these are all things that I witnessed. And I had to really push back on and say, look, as a board, we meet at board meetings. Don't come into this space. Give the staff space. Don't have one-on-one conversations with my staff to drive decisions. That's my job as a CEO, because that's why you audit me. So integrity at the board is primal. And then integrity at the CEO's office, really important, because the CEO is at the center of all this. They can help the board, support the board in training and good governance, correct where, you feel there's overreach, give guidance where you need space, and say, look, give us space, give my team space so we can perform, and be clear that I'm running an institution with integrity. Don't try and coerce or ask me for favors that are going to deviate from standard operating procedures of the hospital. So set that message very clearly. Again, at CEO level, you can get a failure of governance by the CEO having parochial interests. It's a very powerful position. They could drive it. They could collude with board members, and they could collude with their staff. And then, you get chaos. And when you go to the staff level, these guys read off the top. I had very junior staff working in the front desk, interfacing with patients, who took away a lot of money from the hospital. and I can't go to the detail of it, but in the situations where I had conversations with them, they said, but everyone's doing this. We are aware that board members are making a killing here. We think you are making a killing as well. It was so imbued in them that for them, it was only natural that let me pick the scraps that fall around my role, because these guys are so busy doing the same thing, they're not going to notice me. And with the new sheriff in town, we were looking and we were cleaning house. So when all that goes wrong, as I've described, at the end of the day, a patient will come to that hospital. Well, at the end of the day, priorities will be wrong. So for example, you may get doctors who are not well paid. Yet these are the people who interface with the patients. Nurses who are not well paid. And the impact is the quality of care that the patient gets is compromised. Patient still pays the same amount of money, but they're getting very poor quality of care. The attitude of the health workers towards those patients will be poor. They don't care because, the money I'm paid here, I could earn it if I work in a government facility. It's less than the effort I'm being asked to put in. So patients have a very poor experience, and in the worst of it, they might pass on. And then if you look at procurement, you're going to be buying at the worst prices. You're probably not going to be buying quality stuff. And again, in the health sector, quality is king. If you don't have quality medication, the impact you can have on a patient's recovery can be huge. And I've had many examples in other hospitals, not this particular one, where people were actually buying the wrong anesthetic or something that is supposed to be an anesthetic, but it's not. And you get your post-op recovery being really, really bad. So ultimately, the patients will pay the price. They'll have very poor care. And ultimately, the institution pays the price because an institution like that doesn't survive for very long. Sooner or later, someone else who does it a little bit better than you will grow and eat into your market share. So it's really important that we get it right if we want to build institutions that are growing from strength to strength and that will survive the test of time. If governance is wrong, then the Nairobi hospitals and the others become institutions that are ephemeral and that might not beat the test of time, which would be a huge shame given the forefathers who founded it and started it as an amazing nursing home, and built it to where it got to.
Yes. What is incredible is that, all of this is not managed in the appointment and approvals of the board in terms of looking at what conflicts individuals may have and how that would affect them in performing their duties. So it's quite interesting that you have people like that being selected to come and perform that role. The perception is that these problems are more inherent in the public sector. So it's very interesting to see a premier private healthcare institution like Nairobi Hospital grappling with issues such as this, which really makes you wonder, where do people go if people like Nairobi Hospital are performing at this level? And it's not just hospitals. So at the moment, USAID recently stopped supply of antiretrovirals through KEMSA, Kenya's Medical Supplies Authority, citing allegations of corruption and mismanagement at KEMSA as a reason for not wanting to work with KEMSA anymore. So right now there's a standoff between the government of Kenya and the United States Agency for International Development over how medicines that the US government is donating to the people of Kenya will be delivered. Whether the government of Kenya continues to receive those or whether they get a third party to receive those. And USAID would like Chemonics International to be the recipient of those products. And the Kenyan government is not very happy with that. And what is interesting, what I'd like you to comment on, Allan, is the fact that we've looked at KEMSA as one of the institutions that's doing very well all over Africa. People come from Zambia, Zimbabwe, and other places to learn from KEMSA. They've received a ton of support from USAID, from Danida, from the government of Germany, from many people to improve their capacity. And yet we find ourselves in this situation. So My question is it possible for us to build the capacity of these institutions? We pump in money, investment to build that capacity, to develop that institutional capability that we need to better serve the people of Kenya or whatever country it is, because you can take this situation and transplant it in many African countries and it probably is a challenge as well. But why is it so difficult to build capacity of these institutions?
Mm. Again, it's down to governance, Lenias. So I've never worked for KEMSA, but I'm also very saddened by what's going on. And I do really hope that they make a recovery reputationally and operationally from the current situation. I think a lot of this came into light with the COVID pandemic, when there was a global supply chain failure of COVID equipment everywhere, including Kenya. And some unscrupulous individuals took advantage of this and leveraged the leadership of KEMSA to bring in what they could find, be it PPEs, gloves, etc., at exorbitant prices. And KEMSA then ends up with huge stocks of these very exorbitantly priced PPEs and so on, which towards the tail end, they could neither use nor sell because the counties refuse to buy at the prices that would even allow them to break even. And so in the end, there's a delta there between the price at which they purchase the PPE and the price that they end up selling at, a negative delta, which completely defeats the purpose of having a KEMSA. So at the heart of all of that, again, is governance and unfortunately, I think interference. I don't know the detail of it because, as I said, I've never worked for them, but somebody signed off on these decisions. And the question becomes, did they sign off of their own accord to serve their selfish goals, or were they under duress? And the challenge we have in Africa is when someone has been under duress, they often are not in a position to divulge where the duress has come from without putting their lives at risk. And so you end up with the taxpayer absorbing that cost at the end of the day. And then it becomes yet another scandal that in 2-3 weeks we are supposed to forget about and life goes on. But back to my point at the beginning, when bad decisions are made in the health sector, people die. And if your signature is on that bad decision, then your signature is on those death certificates. You may not see it now, but one day somebody will point that to you, People are different. There are people, I guess, who have thick skin and don't care about stuff like that. That bugs me. I wouldn't be able to sleep. And I think people need to be shown the line of connectivity between the decision they're making and sometimes actually their own relatives. Because that person who perpetuated that scandal, or those people who did, ultimately they do have relations, if that's all they care about, they do have relations who will not have access to those things because they had to make some quick money up here in Nairobi. So the staff never reaches Kisumu, the staff never reaches Muranga, it never reaches Mombasa, because the governors in those counties say, we're not going to buy at that price, And when the PPEs are not there and your relatives going to hospital with COVID, they're going to die. If the ventilators are not there, they're going to die. The oxygen concentrators are not there, they will die. Not everybody has a conscience, unfortunately. And unfortunately, we live in a system that still props up leaders who don't have a conscience to be in positions of responsibility. In a system that muffles the consciousness of leaders very quickly because they realize they're in a minority. And it's either you join us or you sink, And unfortunately, many people fall into that and say, you know what, there's just me here. What change can I possibly make? Let me just do what they want me to do. And then you become part of the system, So I'm very saddened by what happened with KEMSA. I'm very saddened by KEMSA's current situation. I'm not surprised the US has taken the stance that it has taken. I think there will need to be demonstration of systematic and sustainable change in the governance of KEMSA to win back confidence of USAID and others that it can still deliver on the role that it does. To your point, institutions are not bad of themselves. Leaders make them bad. Somebody made KEMSA go down the way it did, And those in positions of responsibility need to understand that you are accountable for what happens on your watch, and that the $10 million or $1 million or $2 million you can make off that one deal is not worth the legacy that your children will want to remember you for. Because one day the truth of that comes out. And shame on the person if their grandchild has to ask them, what happened? You were the one who was responsible,
Absolutely, absolutely. But you, Allan, you have worked as a senior executive at one of the top global pharmaceutical companies, GSK, which I'm sure has worked with donors on various projects on which you're bringing in products into countries. You were leading for Africa, I believe. Did you ever encounter a similar situation to what's playing out in Kenya right now, where there is a conflict where the US government would like to bring in products through Chemonics, a third party, and the Kenyan government says, well, in that case, they have to pay tax because they are a private entity. They cannot bring in these products with the tax benefits, tax exemptions that would be applicable to those products if they were coming directly from the government of the United States and being received by the government of Kenya. I mean, how does that work? I'm just trying to get my head around that. Have you ever encountered something like this, and what could be the resolution one can foresee in such a situation?
We did in different forms, but we did. Very often, let me give you an example. This was in Nigeria, actually. When I was leading government affairs for GSK in Africa, we had, there was a scientific conference happening in Nigeria. And we were going to have a stand where we were going to showcase the products that we have as a company. And so, this was shipped in, and we shipped in quite early, probably 2 months before the event, just understanding that to go through customs, you need to go through that entire process. And we had our customs bill, and we knew what we needed to pay, and we were ready to pay. But there was an additional taxation that came into play, which was not founded in law, because we got local teams to investigate and understand what are all these additional taxes about. And it was basically a tax being imposed by the head of the port, realizing that this is a big pharmaceutical company coming to do this, and time's ticking away, and it's big money for them because it will launch their products and so on. The clock ticked down to the last day before the conference, and on the last day we asked, and the guy said, yes, you still have to pay whatever it was, $50,000 extra, unreceipted, for this to come in. And we try to appeal to government agencies. Nobody pays you any heed because there's a cartel there. And you take that back to the company and you say, okay, this is a big event. Stuff is stuck in the port. We are on to the last day. Clearly, if we don't pay this guy, we're not going to have a stand. And the company was very clear. We will not have a stand. And believe you me, the shipment never went in. During the conference, a day after the conference, he said, you can bring your stuff in. That's what it is. That's what happens, And it can make you very angry because this is an individual doing this. Yeah. But more angry because the government systems are not built to check this and make sure that it's not happening. In fact, sometimes the government systems are behind it, And then how does Africa progress? How do we say that we are moving, to Africa rising? We won't. We are our worst saboteur. and it's leadership with integrity. Not necessarily the best example, but if you look at Rwanda, and people will, point out the strengths and weaknesses of it. It's a small country, yes. You can run it like a company, and so it's easier to do these kind of things there. But my experience flying into that country, Lenias, is so different than many other African countries. Right from the airport, the organized queue, the questions that are on point on what needs to be asked and nothing more. You answer those you're in. You don't answer them, you're not coming in. It's as clear as that. They follow the rules. And, going through government services in the country without having to worry about who do I need to pay to move this from point A to point B. We lose a lot of money in Africa to corruption. It is a culture, and it is what's slowing us down. If you look at all the money that governments collect in taxes, our President Uhuru said, I lose 2 billion shillings a day to corruption, in Kenya. Imagine what 2 billion shillings can do for the development of our country. It's just down to bad governance.
Yes.
And we hope that one day we begin to change our culture and create a new culture where corruption becomes a strange thing, if you are confronted by it. It's a bit like when I first went to the UK and, I got a parking ticket and my first reaction was, should I pay this guy? So I just drive off, It's very nice. I had to take a step back and think, hang on, he's a white cop, there's a cultural, thing here. And why am I even thinking about bribing him? It doesn't even occur to them. It's not even something that you even think about. And the Africans who live in that economy behave in that way. No one's trying to bribe anyone. No one's trying to take, maybe they might take kickbacks, but not to the extent that you see here, So it's a culture, it's a system that ensures your tax money and my tax money actually serve the purpose they're meant to serve, not the purpose of the person who is in power at that point in time.
Yes, and I think President Kenyatta have actually declared corruption to be a threat to national security, and it takes political will. So the example that you're giving of Rwanda, we will come to that in a minute, but it has taken political leadership for them to create a system that works so efficiently. And to end corruption, we need strong political will, we need effective law enforcement, efficient corrupt-free judiciary, and a free press. But what's interesting in Kenya, though, you have a very active press. There's a lot, these things are being reported and they are in the public eye, and we can only say that's a good thing because it takes us a step towards the solution. It allows people to ask questions. But Kenya is interesting because you have the legal frameworks that are necessary to fight corruption. You have made significant strides in instituting legislation to criminalize corruption. You have the Anti-Corruption and Economics Crimes Act of 2003. You have the Penal Code, which is criminalizing corruption and bribery and all of those things, money laundering, abuse of office. These laws, this legislative framework, is it just not being implemented? If you have the president saying this is a threat to national security, the tools are in place, and yet we have all of these problems happening. Why?
Good question. We have all the tools. You're right. We have all the tools. We can do it. My personal view is we do need to get to a point where our executive and our judiciary completely agree to read off the same hymn sheet. To me, that's probably the piece of the jigsaw that's still missing. The day they do that, I think we're going to see some really tangible change, because you begin to see some of what you said, that actions have consequences. If you have a KEMSA scandal, COVID scandal, it's investigated, root cause found, judiciary deals with it, and there are convictions. And there's no political patronage and sacred cows that cannot be touched. I think at the moment, we are in a situation where it feels as if there's a frustration on both sides. The executive is frustrated the judiciary is not prosecuting enough. And I think the judiciary is frustrated the executive is not allowing them to prosecute everyone, including sacred cows, And so there's a standoff. And at the end of it, it just becomes lip service, to be honest. We go from scandal to scandal. It feels as if Kenya's memories are very short, or we've just become jaded by corruption. You almost know who did it. In all these cases, you know who did it. And you almost know they're going to get away with it. And then the whole thing plays out as it always does. The small fish fry, and then you're on to the next one before you can even process the first one. And then it's one after the other, and then you just switch off. And then it becomes a way of life. And unfortunately, those who get away with it become heroes. And the youth begin to admire them because now they have the bling, they have the cars, they have, the flash with money and so on. And the system perpetuates itself. So there's still something that we need to do. And to me, it's the nidus between executive and judiciary sitting around a table and saying, we're going to slay these beasts and we're going to slay it together. You do your bit, let me do my bit. Let's do a 5-year period when we clean house. And after these 5 years, people begin to think twice before they rob the taxpayers' money.
Being very decisive in taking action and having repercussions for those actions and being very clear about it. Let's talk about what works. In your role as an executive at GSK, you've had the privilege of working all over Africa and you've had a chance to interact with many governments. You mentioned Rwanda as an example of a country that has systems that are working as they should, where you don't have to necessarily pay a bribe to get things done. Rwanda, I think, and Botswana are quite notable because they have made significant progress in their fight against corruption. And I think for all of us all over Africa, it's an interesting conversation to have, to look at what examples are there out there of what actually works against fighting these practices that have become so normalized in most countries in Africa. And in the Transparency International Corruption Index, Rwanda and Botswana are ranked the best in sub-Saharan Africa and performing better than Italy and Greece and Hungary. And Botswana apparently even outperforms Spain in this. So from what you've seen in your work across Africa, these countries that are successful against corruption, what is it that makes them so successful and what can others learn from them? What lessons can we all take from how they're doing things in their countries?
My answer to that is a difficult one. And it's a big other topic, which probably we'll speak about another time. Yeah. And it's about what is African democracy. If you look at those two countries, they have had leaders who have a very long-term view of the country and a long-term vision for the country. And good or bad, some of them have stayed for a long time, and we might probably see them for a long time yet, because they are holding on to a certain vision for their country. In many ways, they are benevolent leaders to the extent that they get as close as possible to ensuring that tax dollar reaches everyone in the country. So if you look at our closest neighbor, Rwanda, I'll tell you a story. When I was with GSK, I had a meeting with the Minister of Health there, who was a friend of mine, and we were just talking about the difference between Kenya and Rwanda. And she told me, when I was appointed minister, Allan, I cried. So I said, why? And she told me, the amount of responsibility that goes with this role, it scares me. I didn't want to, she didn't want to be a minister. It's an honor, obviously. At that point, her salary was probably $4,000. That's it. You get a government car and a government house and a bodyguard. That's it. And then she told me that there was an event that happened when she was in cabinet, one of the ministers, one of our colleagues, was building a house, and he imported building material. And there were, I think, about 7 containers. The first 5 he paid for in terms of duty to come in. Then the last 2, he called the port and said, just let them come through. And they came through. She told me the same afternoon, the 2 containers passed through without tax. There was an announcement by the president that the minister had been sacked. Same day.
Wow.
The president had that information, acted on it very decisively. He was sacked today and was in court the next day, literally from a government, very high government office. And this minister was a distant, or I don't remember if it's distant, or close relative of the president's wife. Now, how powerful a message can you get more than that? And he said, you don't mess around with taxpayers' money. It doesn't matter if you're related to me or you're a minister. We're going to lock you up. So by the time I was talking to this particular minister, that particular minister was in jail. And what provoked that story was we were driving to go to Gisenyi, which is near the border with Goma. We saw people in jail. They bring them out to do the road, to do this and so on. And I was telling her, wow, you're very organized. They're productive. They're building roads. They're doing this. And then she said, no, there are ministers there. There are mayors there. There are people who are very prominent there. Now that is how you slay the dragon of corruption. You've got to be very decisive and not discriminatory and swift. Yeah. It's headlines the next day. Everybody gets to read it. People will love you. The common man on the ground will love you because, that's their money being stolen, Strong political will goes a long way. You create that sense that there's going to be accountability. The collaboration between the executive and the judiciary is important. In this particular case, I think Kagame has a rule that high-profile cases are not going to be kept on a queue in the judicial system. They're prosecuted very quickly, So there's no time for you to bribe the judge, get this, get that. It's dealt with, and we move on, That collaboration is really important. And then thirdly, I think they have succeeded in creating a culture and a mindset that I'm happy with what I have. I don't need to steal something that is not mine in their youth. So they're raising, at least those born since Kagame has been in power, a generation of young leaders who don't really understand why you need to be corrupt because they're not exposed, they don't see it. They read about it in neighboring countries, but they don't experience it. Or if they experience it, it's so small, it's inconsequential to the economy. So it takes a visionary leader and a strong leader, as I call them the African strongman, to lock the borders and say, I'm not going to have this around me. And unfortunately, which is back to my question around what is African democracy, we are all in 4 or 5 year election cycles where leaders come in and they're very myopic in their planning and their thinking. And there's a lot of cronyism, so they have people who got them where they are. You hear this in every African country. When you become mayor, governor, president, there are people, often even in the private sector, who support you to get there. Then when you get there, the way we repay them is we give them jobs, whether they're qualified or not. We give them tenders, whether they will supply or not. And we forgive them when they sin and they do anything wrong, leveraging our power. We need to break that. I don't know how we break it, but, having leaders who are not looking around and say, I owe so many favors that I have to be corrupt to survive the next cycle of elections. That plagues us. And that drives, this cycle of corruption that then becomes inculcated in the minds of children from when they become aware, primary school, secondary school, they come out, of university or colleges, etc. And they're thinking, how can I make a killing? In Kenya, they talk about tenderpreneurs, these 20-year-olds, 21-year-olds who are becoming millionaires off tenders. How? It can happen, but it can't be the norm,
Yeah, absolutely. No sacred cows in Rwanda by the sounds of it, for sure. They will come after you.
Oh,
And,
yes.
and just to add on your point, I've read that one of the things that they've done in Rwanda and Botswana was to abolish the ineffective colonial system of governments, which apparently is very
Yes.
amenable to all of these corrupt practices. And they've used a single anti-corruption agency instead of using the police, for example, to fight corruption. So obviously those things do make a difference when they are
Yes.
instituted and leaders actually follow through to enforce them and to show people that they mean business. And it's a great point about actually inculcating this value in the youth, right? It's about the mindset, isn't it? How you
It is.
think about, how the young people think about wealth creation, whether they want to get rich very quickly with whatever means necessary, as long as you get to the money, or whether they have values of respect and integrity that you're talking about. For all the rampant corruption that you see across Africa between the interaction of African governments with donors or with their citizens and institutions, we are not talking about how to solve this problem enough. I was reading yesterday, the Minister of Health from Peru, she did an analysis trying to just see what kind of solutions people are looking at out there in terms of solving corruption and what works. And she saw a woefully small number of publications of just people studying this problem in order to figure out what could work for us to get rid of the problem in low and middle income countries. So I think we need to have more of these and engage with citizens and so forth. So we are right at the end of our conversation, Allan.
Yeah.
And normally at the end, we ask our guests to leave us with some thoughts about how to close the gap, looking at where we are and where we need to be in terms of solving, in this case, the challenge of corruption, which is hurting the people of Kenya, the citizens of Africa. What would you say are some of the things, from your experience as an executive in the private sector with GSK, from your experience as a physician in Kenya, as an executive of a premier Kenyan health institution? What are some of the major things that you would like to see that you think they would move the needle and close this gap between where we are and where we need to be?
Yeah, so one of them is, if you are in any position of responsibility in Africa as a leader, if you're called a leader, whatever the level is, I'm very sure you find yourself in a situation where containing corruption around you feels like boiling the ocean. But you have to understand that it starts with one person and you have got to count. It is a huge sacrifice that you may have to make, but believe you me, the one thing that is so sure is that if we're lucky and we live our full lives, a time will come when we're not in those positions. And we're going to look back at what we did when we were in those positions. It will not be about the money we made. It will be about the sacrifices we made to say, no, I'm not going to do that because it's wrong. And by sacrificing getting that kickback, probably someone else will get the service they deserve. Probably a child will get the treatment they deserve because of the decision you make. So that realization that the decisions you're making now may haunt you in the future or may be a blessing for you in the future when all you have is your memories of the life that you had. So that would be my message to the leaders. Feels like boiling the ocean. Continent's huge, the countries are big, institutions are very big, but believe me, what you do is noticeable. And if more and more people live integral careers, then you begin to get some kind of effect. So that's to the leaders. To the population, again, I think it feels overwhelming. And if I speak to the Kenyan population, because I kind of do the journey with the population here, we read about scandal after scandal after scandal. Don't let up. Let's talk about it. Let's not stop talking about it. when we go to the ballot box, let that be our consideration of who you're choosing. Increasingly, let the leaders know that it is an important campaign point that they're leaders of integrity, not just people who will promise to give you, a school near you or a church near you. So those are token gifts. Those are things that you already deserve. But do they have a clean track record of integrity? Because the person who promises to give you, even you as a person, $10 to get your vote for that day will be the person that will take $1,000 that you deserve in healthcare, in education, in all the other sectors. So keep talking about it, call out the wrong leaders, praise the people who have shown good example and extol them and push that they are recognized and extolled. We have enough examples. And choose every time you have an opportunity, choose with integrity as one of your criteria. I think if everybody did a little bit of those things, then maybe we'll start moving the needle a little bit. It is a big ask. Ultimately, to be honest, the big solutions sit with, as I said, the executive leadership and the judiciary leadership in a country. They get together and say, we're going to contain this. They can't do it. But that depends on their largesse as leaders and on their vision for their country as leaders.
Absolutely. And I suppose if we as individuals, as citizens, were to realize the power that we have to hold our leaders accountable and being able to exercise that right, that I can choose not to vote for this person to elect them because they are not serving our needs or what they do is hurting us. That has incredible power. I absolutely agree, because it starts with the individual and we can extend that power to the community, and so it goes as a wave. Dr. Allan Pamba, thank you so much for coming onto our podcast. It's a pleasure to have you.
Thanks so much, Lenias. It's been a pleasure to have the conversation with you. And I do hope you carry on these conversations with other leaders, because Africa needs this.
Thank you. And I hope that we can welcome you again. We have so many things to talk about. So please do come back and we can continue the conversation.
Thanks very much, Lenias.
Wonderful. Thank you so much. Bye-bye.
Bye.